Thank you for all being here today. Governor Pritzker and distinguished guests, it's a pleasure to have you at Rush University Medical Center. Thank you for choosing Rush as a place to sign this incredibly important legislation. I am Dr. Omar Latif, and on behalf of the entire Rush University System for Health, we welcome all of you. While others will speak much more in depth about the Healthcare Protection Act and its importance, I just want to say that Rush was proud to advocate for the passage of this bill. Simply put, it makes it possible for all of us to help more patients in underserved communities, helping to ensure they get the access and care that they need. Ask anyone who works in healthcare. Our system needs work. But as someone who interacts with people on the front lines every day, I can tell you that the people in this space believe that healthcare is a human right and believe that getting access to the people that need it is critical. For everyone working on the front line, healthcare is a calling. Barriers to access like roadblocks from insurance companies dampen that spirit. This new bill is about holding insurers accountable and empowering patients and their doctors and nurses to make key decisions based on medical need and not what is profitable. We thank all of you for your leadership and dedication to the health and wellness of our city and state. It is now my pleasure to introduce the best governor in the United States of America, Governor J.B. Pritzker.
Wow, how nice. Well, good morning to everybody. Good morning. Thank you very much, Dr. Latif, and to Rush University Medical Center for the very warm welcome and for your tireless dedication, all of you, for caring for the people of the city of Chicago and the state of Illinois. I want to especially say that, for a couple of years, Dr. Latif and I worked very, very closely together as we battled, all of us, COVID-19. And I must say, I was saying on my drive over here that there's nobody that I dealt with who was more helpful, who gave better advice, who was more available than Dr. Latif. So I just want to once again thank him. He helped us get past a terrible time. I am very proud to be here with all of you to stand up for the patients and families of Illinois by officially signing the Healthcare Protection Act into law. Over the past few months, I have traveled across the state of Illinois, talking to doctors and patients, to advocates in every corner of our state. And at each and every stop, I have been able to talk to people and meet with the same chorus of resounding support for this legislation. That wasn't a surprise to me. The HPA was conceived, written, and passed with the goal of empowering the two most important stakeholders in the medical system, our patients and their doctors. This bill is fundamentally about putting medical decisions back in their hands. For too long, insurance companies have used predatory tactics to make an extra dime at the expense of Illinois consumers. For too long, patients have delayed or been denied medically necessary treatments because of profit driver utilization management practices. For too long, shoddy networks, price gouging, and overly complicated bureaucracies have stood in the way of our families getting the care that they deserve. Today, with my signature, Illinois is addressing and rectifying that problem. When I proposed this legislation all the way back in February, I promised that I would put my shoulder to the wheel to get it done, and I did. There was resistance, as we expected there would be. But I didn't get there alone, and there are so many people to thank, several of them here with us today. First, our chief sponsors, Representative Anna Miller and Senator Robert Peters, who worked tirelessly to craft a package that met the needs of all of our stakeholders. Senator Laura Fine, who's been at this for so many years, I want to thank you for being a partner in this. She got Democrats and Republicans together to give this a strong bipartisan majority. And Representative Bob Morgan, a consistent champion of quality health care throughout the state of Illinois. As always, President Harmon and Speaker Welch were stalwarts, along with the rest of their team of legislators that are, well, sitting behind me, and some of them aren't here, but collectively this General Assembly really did amazing things, and I want to thank all of them. To the many patients and doctors and consumers whose experiences and advocacy helped to shape this legislation and get the message across to those who might have been hesitant to vote for it, thank you. Thank you for sharing your stories. People needed to hear those stories. And of course, thanks to my partner in governance and a tireless champion for working people everywhere, our Lieutenant Governor Juliana Stratton. There you go. I also want to acknowledge my staff, the governor's staff, who worked tirelessly behind the scenes to craft and help pass this legislation. While making special mention here, I want to especially focus on one person on my staff who from the very beginning crafted the messaging, put her time and effort and energy into every detail of this bill, and that's Emily Miller, who's, yeah. She really put in countless hours of effort. Unparalleled ingenuity was required to get this done, and she really helped to make this all possible. Anyone that knows Emily understands how vital she is to our operation in the governor's office and how deeply she embodies the spirit of public service. I feel very lucky to have her on my staff. I'm truly grateful to have advisors and leaders like her working for me and with me every day. This incredible coalition of experts and legislators, doctors and patients and patient advocates put together a nation-leading bill that puts Illinois on the way to a better, fairer, and more affordable healthcare system. We got there through a thorough and deliberative process that brought every key stakeholder together and identified the barriers that individuals and providers were facing in search of quality care. From that process, we developed a comprehensive package of reforms across the industry that targets the practices that actively make care less affordable and harder to access. We had to work one by one through all of these things to eliminate those barriers. This new law eliminates step therapy, a practice where insurance providers require patients to try and fail often less effective treatment options before getting the care originally recommended by their doctor. Perhaps this seems controversial to the insurance companies, but I don't believe an insurance executive hundreds of miles away knows more about medicine than the doctor in the examination room with the patient. We also eliminated prior authorization for inpatient mental health care because a person in need of immediate help shouldn't have to jump through hoops during a crisis. Illinois, by the way, is once again a pioneer, the first state in the nation to do this for adults and children. I'm going to digress from my speech a little just to tell you that I got a call shortly after I talked about this bill in my State of the State speech when I introduced this, from a longtime friend who had not revealed to me what he said, which was that his daughter had attempted to commit suicide, and then she tried again a second time. And on that second attempt, he was in the emergency, he was in the ambulance on the way to the hospital with her, calling the hospital and then calling the insurance company, needing prior authorization. And they denied him prior authorization. And he had nowhere to go. He had nothing, there was nothing left for him to, he could not take his daughter home after she had attempted suicide. He could not take her anywhere else. This was the only hospital that could take a patient like her. And he was lucky. He knew the president of the hospital that he was headed to, so he called him at 12:30 at night, and was able to make arrangements for himself. But almost nobody has that ability. And when he called me, he said, he was almost crying on the phone. He said, "Thank you. You've changed people's lives." And I think about that a lot, that particular instance, and I'm choking up thinking about it, when I think about what we've done here with the HPA. We really have saved lives. So we did even more in this legislation. We increased transparency in insurance coverage. We set new standards for appointment time availability and number of in-network doctors. We banned the sale of junk insurance plans that don't meet the affordable. Those are plans that don't meet the standards even of the Affordable Care Act. We eliminated ghost networks. For thousands of Illinoisans, the reforms in this bill will mean the difference between, well, suffering with curable health conditions and getting the care that they need in a timely manner. And for some, this bill will quite literally save their lives. As you can tell here at Rush Medical Center, Illinois has some of the smartest and kindest and most advanced healthcare professionals in the entire world. And with my signature today, we're going to make it easier for them to do what they love and what they do best. Thank you to all of you who are here to stand up for the people of Illinois. I look forward to building on this progress to make sure that every resident of this great state, regardless of their age, race, income, or zip code, gets the quality care that they deserve. With that, it is my great pleasure to introduce a leader, a partner, a friend, our Senate President, Don Harmon.
Well, good morning, all. Good morning. Thank you to the Rush family for opening up the facilities here for us today. The Illinois Senate Democratic Caucus has long been committed to quality, accessible health care. And in addition to our sponsors, we are joined here with several healthcare champions, Senator Willie Preston, Senator Lakeisha Collins, Senator Rachel Ventura, among others, all here, so please give them a round of applause. It's also a point of pride that we have a couple of Senate alums on the roster as well for speakers, including the former Senator, now Director of Insurance, Ann Gillespie, and former Senator, now Head of the Hospital Association, A.J. Wilhelmi. Testament to our long commitment in the Senate caucus. Thank you to a world-class team of healthcare professionals here at Rush for the excellent care that you provide in this community. Thank you to the sponsors of these new laws, Senator Robert Peters and Senator Laura Fine. Without your hard work and unwavering belief that healthcare should be accessible to everyone, none of this would be possible. You really did a remarkable job in getting this over the finish line. Today's bill signing is the culmination of a massive effort on the part of our colleagues, Governor Pritzker, and advocates. A massive effort to put into law something that seems like it should be common sense. Health insurance companies should be focused on making people healthy. But somewhere along the line, priorities got out of whack. Instead of helping patients find the best care for their individual needs, the focus too often shifted to maximizing profits. These laws to be signed today put control back in the hands of patients and their doctors. They ban predatory insurance plans that charge more for a lower standard of care. They eliminate inefficiencies that cause patients to wait far too long for necessary treatments. They will lower health care costs, and they will save lives. So thank you again, Governor, Senator Peters, Senator Fine, for your great work and your dedication. With that, it's my privilege to welcome up another partner and a good friend, the Speaker of the Illinois House, Speaker Chris Welch. Where'd you go?
Good morning, everyone. I want to thank my friend, the Senate President. He's been trying to recruit me to the Senate for a long time. I like my job in the House, though. I'm thrilled to stand here with Governor Pritzker, Lieutenant Governor Stratton, my colleagues in the House and Senate, and the countless advocates that helped get these monumental pieces of legislation on the governor's desk today. I want to give a special thanks to my colleagues in the House, Leader Camille Lilly, Representatives Moeller and Representative Morgan, true healthcare champions that really helped get us here today. Can we give them a round of applause, please? You know, I want to give a special shout out to Reps Moeller and Morgan. I got to tell you, they are tireless advocates for improving health care in the state of Illinois, and they worked really hard on these pieces of legislation. You know, this legislation will put the power back in the hands of patients, where it should be. Putting power back in the hands of patients by banning step therapy, banning prior authorization for crisis mental health care, improve network adequacy, banning junk insurance plans, and end unchecked rate increases by large insurance companies. We're putting patients before profits. We're putting patients' health care before large insurance companies. This is what it should be about. Today we stand here making Illinois the first in common sense reform by banning prior authorization for inpatient mental health care. It was just simply the right thing to do, and I'm just so proud to be a legislator in the state of Illinois, putting patients before profits and helping to get us there, to help us land the plane with the Healthcare Protection Act was Representative Anna Moeller. Please welcome her to the microphone.
Good morning. It's an honor and pleasure to be with you, and I too want to thank the superb healthcare professionals here at Rush. We are grateful for your service and all that you do for patients in our state. Today truly marks a milestone for the health and well-being of people in Illinois, and I'm honored to be here to witness the signing of the Healthcare Protection Act and to talk a bit about this transformative impact that this piece of legislation will have on our state. The Healthcare Protection Act makes significant reforms to tear down the barriers that have long prevented patients from accessing the health care that they need. For too long, these barriers, including the use of step therapy, prior authorization for crisis mental health care, unreasonably high premiums, and unjustified denial of treatment, have been a source of frustration, pain, and financial hardship for countless Illinoisans. With this act, we are taking bold steps to ensure that patients in our state receive the care that they deserve without undue delay or financial burden. I want to extend a deep sense of gratitude to Governor Pritzker for his incredible leadership and the superb professionalism of his policy team. Emily Miller has been mentioned already. Without their unwavering commitment to health and well-being of our citizens, in bringing this fundamental piece of legislation, this bill would not have come to fruition. Governor Pritzker, your dedication to healthcare reform has set a new standard for what it means to serve the people of Illinois. I also want to acknowledge my colleagues who are here and the colleagues in the House who helped get this legislation over the finish line, including Leader Lilly and Representative Morgan, who sponsored the legislation that bans junk bonds or junk policies. We would not be here without their support. I want to also acknowledge my appreciation for Senator Peters. It was a joy to work with him in partnership on this bill. This legislation is a testament to what we can achieve when we come together with a shared purpose and a common goal. I am also profoundly grateful to the healthcare professionals and patient advocates who helped pass this legislation. Their tireless efforts and advocacy, their testimony in committee, sent a clear message that Illinois deserves better. We heard gut-wrenching stories about why this legislation is so necessary and will save lives. This act is not just about policy change. As has already been stated, this is about prioritizing people over profits. It's about recognizing that healthcare is a fundamental right, not a privilege. It's about ensuring that our healthcare system serves the needs of patients and supports the dedicated professionals who provide their care. In closing, I'm proud to say that with the signing of the Healthcare Protection Act, we are taking a decisive step towards a future where healthcare in Illinois is accessible, affordable, and equitable for all. It's time to put patients over corporate profits, and this law will finally deliver on that promise. Thank you. And I am honored to introduce and bring to the podium Senator Peters.
Good morning. This is a huge day in Illinois. I want to thank the governor, my colleagues in the General Assembly, patient and healthcare advocates, and hospital leaders. I'm especially grateful to be at Rush Hospital. I suffered a very painful fracture to my tibia plateau while playing soccer during the summer of 2018, and the wonderful doctors and staff at Midwest Orthopedics took amazing care of me. And another Rush story that I like to share is when I learned I was adopted, my mom decided to read me my medical report, which talked about me being born hard of hearing. And at the top of it was Rush Hospital. So I'm grateful for Rush Hospital for all that you do. Thank you. This is my message to Illinoisans. Illinois is moving in a positive direction when it comes to your care. Whether it's reproductive care, painful physical care, traumatic mental health care, Illinois, with this governor and this General Assembly and these leaders, is not turning back the clock nor turning back patients when it comes to your care. We're going to ease the stress for you and your loved ones during a mental health crisis. We're going to reduce the confusion when it comes to finding a provider. And instead of the steep steps of care that existed before, we're building an elevator to the treatment you need and deserve. We're ending predatory practices during your most vulnerable moments. In Illinois, we are putting care over cost. And I want to go back to Rush here. I have another memory. There was a moment after my dad died and before Obamacare fully took effect that I was dealing with a medical emergency that made it hard for me to get good care, particularly due to a pre-existing condition. I was desperate, and I came to this hospital's ER to seek help. I was lucky to have found a doctor who gave me antibiotics and sat with me as I struggled to explain the chronic pain I was in. He sympathized with me and gave me some advice. Our systems work best when it is putting people first and it is driven by those values. I know that there are countless others who have or are facing similar challenges in life, and I want them to know that today, as these bills get signed, we are all here doing this work with you, the person in serious need, front and center. Thank you, everybody, and I would like to introduce a fighter for patients her whole career, Senator Laura Fine.
Good morning, everybody. Thank you, Senator Peters, Senator Harmon, everybody who has worked so diligently on this legislation. Another shout out for Emily Miller, who has devoted her career to this as well. Imagine going to the doctor and learning of your diagnosis of cancer or MS. Now imagine your insurance, which you thought was there to protect you in a crisis, did not cover a new diagnosis, a pre-existing condition, or even your prescription medication. This nightmare has been a reality for countless people in the state of Illinois. These residents purchased short-term limited duration plans for their health insurance coverage. Sadly, these consumers found that when they were at their most vulnerable and needed to use their insurance, their plan had a high deductible and minimal coverage. This has left many under huge medical debt. Short-term limited duration plans, also known as junk plans, are exempted from the protections under the Affordable Care Act. These plans are not required to cover ACA essential health benefits like prescription drugs, maternity care, hospitalization, ambulatory services, mental health and substance use disorder treatments, or even emergency services. These plans cost the consumer and profit the insurance industry. Comprehensive health insurance coverage is required to have a loss ratio that is at least 80%, meaning the insurance pays 80 cents on medical claims for every dollar it charges in premiums. But junk plans have no mandated loss ratio, and in Illinois, some can be as low as 32%. That means junk plans, insurance companies are keeping 50% more profit than they do for comprehensive health insurance. That burden is on the shoulders of the consumer. With this legislation, banning the sale of junk plans, individuals and families in Illinois will have a better option when they need coverage due to issues like job loss, turning 26, or moving off of Medicaid. Illinois will soon have a state-based exchange where consumers can go to purchase a temporary ACA compliant plan and possibly receive government subsidies to help them pay for this comprehensive coverage. This will ensure consumers have the insurance coverage they need for better outcomes. I would like to extremely thank Governor Pritzker, our incredible Lieutenant Governor, the amazing advocates, because these advocates are on the front lines every day fighting for what people need. The Department of Insurance for their advocacy on behalf of all consumers in the state of Illinois. And with that, I'd like to introduce my partner in this fight, Representative Bob Morgan.
Good morning. And thank you, Senator Fine. Approximately 6 months ago, Governor Pritzker introduced the Health Care Protection Act. And there was a lot of grumbling. There's a lot of skepticism. I heard a lot of people that doubted whether or not the governor and the legislature was going to follow through on such transformative health care insurance reform. But with the governor's ironclad commitment and with incredible, terrific leaders like Representative Moeller, Senators Fine and Peters, we got this done. Not without, of course, the amazing help of policy leaders like the Shriver Center and also Inseparable. In addition to driving down health insurance costs through rate review, something Senator Fine and I have been working on for years, ending step therapy and prior authorization, and rooting out ghost networks, today we ban junk insurance in the state of Illinois. Too many residents in Illinois have been tricked into buying these limited duration plans for bridge insurance coverage, only to find out they were flying a plane without a parachute. The junk insurance, yes, it may be cheaper than being fully insured, but many of these junk plans do not cover behavioral health. They do not cover pre-existing conditions. They may not even cover hospitalization. What kind of health plan doesn't cover hospitalization? A plan that is not a plan at all. Preying on the sick, vulnerable, and budget-constrained is deceptive. It's a malicious practice. And come January 1st, this practice is going to end in the state of Illinois. I'm incredibly honored to have been a part of some of the major healthcare reforms that we have passed in past years, and you can bet that we will build on this momentum to lead the nation in healthcare in the years ahead. Today marks a major step towards healthcare equity, and we will use this legislation as a benchmark for our future efforts towards a healthier Illinois. Believe me, this legislation has grabbed the attention of elected leaders throughout the nation, looking for ways to increase healthcare costs and accessibility. Today, Illinois, to increase the access and affordability, rather, decrease costs. Today, Illinois is truly walking the walk and enacting meaningful health insurance reform. Thank you so much, and it is a pleasure and an honor to introduce my friend and partner as the Director of the Illinois Department of Insurance, Ann Gillespie.
You know the drill. Good morning. Thank you, Governor Pritzker, for your leadership on health insurance reform in Illinois. As Acting Director of the Illinois Department of Insurance, I'm proud to stand here with you as you sign the Health Care Protection Act, and I appreciate you entrusting the Department of Insurance with this important work. Having spent my career in the healthcare field, I know firsthand the challenges that consumers face navigating health insurance coverage that all too often puts them in the middle between the advice their providers give and insurers, and the critical role that state regulators serve in the insurance industry. So I welcome the department's increased authority under HPA to hold insurers accountable to cover the healthcare services consumers pay for every month without making them jump through hoops. I'm proud that Illinois is now the first state to ban prior authorization for inpatient adult and children's mental health care coverage, further increasing protections for mental health, adding to those already enforced under the mental health parity laws. I'm proud that Illinois will now require even greater network transparency and protections for consumers that they need to ensure that their trusted provider is an active member of the insurer's network before they purchase coverage. That transparency protection will now extend beyond the initial purchase by requiring insurers to provide the department every 90 days with an up-to-date audit of each network plan so that consumers have information about any recent changes. As we transition to the state-based ACA marketplace, HPA's ban on short-term limited duration plans will help the department ensure that Illinoisans do not mistakenly purchase inadequate health coverage instead of affordable, comprehensive coverage offered on the ACA marketplace. Protecting Illinois insurance consumers is our top priority at the department, and we stand ready to enforce the Health Care Protection Act. I look forward to joining forces with other Illinois agencies and leaders to make sure that all Illinoisans can access health care and coverage that they need. And now I'd like to introduce Stephanie Becker, Director at the Shriver Center on Poverty Law.
Good morning. At the Shriver Center and as part of Protect Our Care Illinois, we work with and for people who struggle to get the health care they need due to insurance industry roadblocks. Over the past 6 months, patient advocates like these have shared their stories to show the necessity of the legislation being signed today. One is Cody, who was diagnosed with multiple sclerosis in 2017. His short-term junk plan refused to cover the life-saving treatments he needed, so he went into debt to pay his bills. Another is Marilyn, who is in the audience today. When her son was diagnosed with Hodgkin's lymphoma, she was forced to fight insurance company red tape to get the coverage for medications he needed, but had been unfairly denied. We believe that a person with MS or cancer should be supported to fight the disease, not forced to fight the insurance companies. That's why we supported the Health Care Protection Act. And because of patients like Marilyn and Cody, the legislators who voted yes, and the governor signing the bill today, we are changing the landscape for patients and families like them for now and in the future. Healthcare should not be a constant fight for what you need. Patients should be prioritized over profits. Today we celebrate the signing of these two bills, which together will ban junk insurance plans and protect Illinois consumers from other unfair and burdensome industry practices. On behalf of the communities we serve, we applaud Governor Pritzker, the Departments of Insurance and Healthcare and Family Services, and our legislative champions on the enactment of this historic piece of legislation. Thank you so much. And now I'd like to bring Bill Smith up.
Good morning. Well, it's so wonderful to be with you today, and I know it feels like everything's been said, but not everybody said it. But I'm with Inseparable, a national mental health advocacy organization founded on the idea that the health of our minds can't be separated from the health of our bodies. And we're so grateful for these legislative champions in both chambers who've been leading for years on this, and for Governor Pritzker's extraordinary leadership today. I also want to thank Heather Weirvault and Dave Horwich, who've led Inseparable's work in Illinois for years. 6 years ago, last month, I lost my brother to suicide after a really long battle with bipolar and depression. This loss devastated our family, and I know, unfortunately, our family is not alone. But I want to celebrate this legislation because there are so many families in Illinois and across the country who've experienced the same problems that my family did, mainly that coverage doesn't always equal care until today. This law is for you if you or your loved ones have ever struggled to get the right medication to treat mental illness and have been told by your insurance company that you have to fail first with the wrong drugs before getting the treatment that you need. If you've ever had a family member, as the governor mentioned in that incredible story, that's in need of inpatient mental health care, only to have to fight insurance company denials through prior authorization, this law is for you. And if you've ever called through an insurance provider directory trying to find a mental health provider only to be forced to wade through inaccurate information, wrong numbers, bad addresses at the moment when you really need help, this law is for you. these legislative champions and Governor Pritzker, you are leading the country right now. And at Inseparable, we're going to work to make this the law of the land for everyone in our country. But we wanted to come here and say thank you because Illinois is doing it first. We just need every governor in the country to show the kind of vision and dedication and leadership that Governor Pritzker has shown. I'd like to now introduce A.J. Wilhelmy, President and CEO of the Illinois Hospital and Health Association.
Thank you. Good morning, everyone. Governor Pritzker, Lieutenant Governor Stratton, President Harmon, Speaker Welch, distinguished members of the General Assembly, and members of the Pritzker administration. It is such a pleasure to join you on this special occasion. And I also want to give a special thanks to Dr. Lateef for hosting us today and for remarkable leadership here at Rush. On behalf of our 211 hospital members at IHA, I applaud Governor Pritzker, Representative Moeller, and Senator Peters for advancing the Healthcare Protection Act on behalf of Illinois patients and their families. In February, Governor Pritzker made it clear that the HPA would be one of his top legislative priorities for the spring session, and he did a remarkable job making the case for this legislation, which is all about protecting patients from predatory health insurance practices. For years, we've heard from our member hospitals that prior authorization delays and denials are a top challenge in delivering timely and appropriate health care, especially when it comes to critically important mental health services. So IHA welcomed the opportunity to work with the Pritzker administration on this proposal, which will make Illinois the first state in the nation to prohibit prior authorizations for inpatient mental health admissions. The hospital community also supported provisions in the HPA targeting practices that allow an insurance company to override a physician's judgment. These are profit-motivated strategies that benefit the insurance company's bottom line at the expense of the patient. As the governor said many times this spring and again today, it's time to put medical decisions back in the hands of patients and their doctors, and the HPA will help to achieve that important objective. So on behalf of our member hospitals, their healthcare workers, and the patients they are privileged to serve, I want to thank the governor and the bill sponsors for their outstanding work on the Healthcare Protection Act. This new law will empower Illinois' healthcare community to deliver the best possible care for their patients. And now it's my pleasure to introduce Dr. Villas from the Illinois State Medical Society.
Okay, good morning. I will start with our best Governor Pritzker, all the leaders here, and ladies and gentlemen. It is very difficult to speak after all the good speakers have spoken already. And I've been traveling abroad lately, and I also have a cold, so you will excuse me. The Illinois State Medical Society appreciates the governor's strong support of putting the medical decisions back in the hands of patients and the doctors. And that is the reason why he's the best governor of the United States. The health insurance reforms passed by the Illinois lawmakers, many of them are right here, will ensure that administrative delays caused by the insurance companies as well as their inadequate provider network, so-called ghost network, should be a thing of the past. So I want to thank all the people, Illinois lawmakers who passed this law. And every person in Illinois, if you want to make sure that every person in Illinois deserves the access to the quality of health care, affordable health care in their communities without any delay and without interruption of the treatment. So this is very important, and this particular governor, I want to thank this governor. He has been taking care of the patients. Illinois Medical State Society is also doing the same thing, to make the doctors and the patients more important, and that is the only way to take care of the patients. And thank you, Governor Pritzker, for signing this new bill which we're going to sign. And we really appreciate the Illinois State Medical Society and their almost 8,000 members do appreciate Governor and their team for doing such a great job. Thank you, Governor Pritzker. Sorry, Governor reminded me. I knew that. I need to introduce the most famous and most famous and most beautiful, Lieutenant Governor Stratton.
Good morning, everyone. I am Lieutenant Governor Juliana Stratton, she, her pronouns, and thank you, Dr. V.S., for your words and for the good work that you do caring for our communities. And thank you to Dr. Lateef and everyone at Rush for hosting us and welcoming us into this space. In the interest of time, I will echo the appreciation that's been shared. Thank you especially to President Harmon, Speaker Welch, and our incredible colleagues in the General Assembly for your partnership, and of course, our bill's chief sponsors, Representative Anna Moeller and Senator Robert Peters, for your inspiring leadership. I do also want to thank all of the patient advocates who told your very personal and very powerful stories. It's so clear that your voices matter. And for as long as I've known him, Governor Pritzker has been focused on delivering tangible results to every resident of Illinois. Among his many priorities, access to quality, affordable health care has been at the very top. Throughout our administration, I've emphasized what the governor's signature does for people. When his pen touches paper today, obstacles standing between Illinoisans in need of care and their doctors' prescribed treatment plans will soon disappear. The Healthcare Protection Act unequivocally takes power out of the hands of insurance companies and places it squarely where it belongs, in the palms of the people. Perhaps most of all, I'm thinking about how this will change and save the lives of those experiencing a mental health crisis. Let me be clear. Insurance-invented roadblocks like prior authorization requirements have put people directly into harm's way. A crisis is never convenient. To demand that someone at their lowest moment has the foresight to seek insurance authorization in advance is both unsafe and impractical. When you need help, you need help. And rather than perpetuate a cycle of harm which leads to trauma, which in turn leads to generational mistrust in support systems, we are changing the status quo. The frustration Illinoisans have come to expect from private health care, well, it ends now. So, for the moms trying to soothe a sick baby, for the caregivers up every hour with their loved ones, for the spouse holding their partner's hand through a tough treatment, the Healthcare Protection Act is tangible change. That is what leadership is about, making life better for everyone. And how lucky are we that leadership is modeled with such compassion here in Illinois. Thank you, Governor Pritzker. And thank you all for being here. And with that, let's get to signing this bill into law.
questions from members of the media? We'll get seated again. We'll take a few more pictures afterward with the sponsors. So. Olivia. You want everybody to tell you what their plans are for future legislative changes. I think here's what I'll try to, I'm sure that if you have the opportunity to talk to the members of the General Assembly behind me, you will hear about some of the things that need to happen to improve our healthcare system. So you're going to see changes, no doubt about it. But let me just say that the number one priority, I think, for everybody that's sitting behind me and probably for all of you, is making sure that we continue to make healthcare more affordable and accessible. I know those sound like buzzwords, and they're, in the political realm, accessibility, affordability, but that is what we think about every day when we think about the challenges in the healthcare system. And this legislation, as you've seen in a number of ways, improves both of those aspects of our healthcare. So without getting too specific, I do believe, though, that the sponsors of the bills, all four of them, because they really do live and breathe the healthcare system and want very much to improve it, will be coming forward with other ideas.
There's other areas that require prior authorization. Does this bill go far enough since it's limited to mental health care, or back to that question, do you want to pursue other areas?
I think there's no doubt that there are areas that are high priority that will get brought up in the General Assembly, and I would be happy to be a leader on. I think there are a few that are particularly meaningful to me. I want to point out that we passed another bill that we're not here to sign today, but the birth equity bill, and that too is about accessibility and affordability of quality health care and saving lives. Because our maternal mortality rate, particularly for Black women, is so high in the state of Illinois, and that bill is intended to address that issue, and we'll no doubt have other things that we'll want to continue to address along those lines. Yes, Mary Ann.
More of a political question.
What? I can't believe you have political questions.
I feel like this is going to get guarded, but since your remarks yesterday, there have been more concerns about President Biden, including one senator this morning, Nancy Pelosi, expressing concerns. Where do you stand at this moment? Are you still 100% behind President Biden's reelection?
As I said yesterday, I'm all in for President Biden. He's going to be the nominee of our party. I said before that he had to make that choice, and he has made that choice. He's made it clear that he intends to be the nominee of the Democratic Party. He's done really a phenomenal job for this country. He's been a patriot who's served for more than 40 years in public office. In fact, more than 50 years now that I think about it, and I think in every way has stood up for the American people and working families. So I will be supporting Joe Biden. He's made his decision, and most importantly, I think to many people, whether they had concerns or not, all of the people, including Nancy Pelosi that you've heard from, want to defeat Donald Trump and know that he is a danger to our democracy, and he's a danger to working families and to people's ability to just to raise their families in a country that they believe in. He is not a patriot, and I think the choice is clear between these two candidates.
Could I ask you about the billboards placed at the RNC by your campaign? Why there? Is that crowd going to care about your message at the Republican convention?
Well, they're not the only ones. So people may not know that Think Big America, which is an organization that I founded that focuses on reproductive rights, has billboards around the Milwaukee area where the Republican National Convention will take place. And they're billboards reminding people that the Republicans are opposed to women's reproductive rights, and that Donald Trump is opposed to women's reproductive rights. And so, the why there? Because there are a lot of Democrats who live in Wisconsin who will see those same billboards and be reminded that just because of the Republican convention going on in their biggest city in Wisconsin does not mean that there aren't a majority of people in the state of Wisconsin that aren't pro-choice and will oppose Donald Trump because he wants to take that right away. Sorry. Oh, sorry. Look, I think we all know that every 4 years we have a presidential election, and we have lots of other elections. And when you go into the voting booth, you're making a decision between typically 2, maybe sometimes 3 people on the ballot. And I think that there's just no doubt in my mind that Joe Biden is a far better choice than his opponent. And so I have no regrets about the fact that I will advocate for him and the fact that I will vote for him in November, and I think he will win. Olivia.
President Biden is going to be having like an unscripted press conference pretty soon. Is there anything that you could see in that that would make you have any of those doubts to
Well, gosh, that is very hypothetical. I don't know. I can only say that I'm not going to deal in the hypotheticals. I said that yesterday. I really think that, look, I think President Biden has said himself he didn't have a good night at the debate. We all, I think, make mistakes along the way on the campaign trail. But this is really about 2 people who have demonstrated their characters, each of them. And I think we all know, because we had 4 years of Donald Trump, what he would do to this country if he became president again. And that Joe Biden is somebody who cares deeply, and Kamala Harris too. The 2 of them care deeply about the future of the American people and will work hard for them. And by the way, just look at the records of the 2. One of them with 50 years of being a public servant. The other one's record is they're a convicted felon, an adjudicated rapist, and frankly, a congenital liar. Thank you.